Bipolar disorder fits in the class of mood disorders. It means that you have episodes of depression, but I'm talking about real depression, major depression, and you alternate those with episodes of either hypomania or mania, which means an elevated state of mood. So the main types really are bipolar 1 and bipolar 2. Bipolar 1 means you have true manic episodes. So when you have mania, you have these psychotic symptoms. I'm talking to God, the Martians are in the television, something that is really a delusion, a break with reality, or you hear things or see things. That is psychosis. Bipolar 2 means you have the depression alternating with hypomania. You never become actually manic, you never have psychotic symptoms. There's also a state in bipolar disorder called mixed state, which is rarer, but you actually have sort of a combination of depression and hypomania. So you may be extremely sad, but at the same time, highly expansive and irritable. And there's even something called cyclothymia, which is a state where you have mild depression alternating with mild hypomania. So your moods are very up and down for periods of time, but you never become severely either manic or depressed.
And a manic episode is an experience lasting at least 1 week where a person feels really great about themselves. They tend to need less sleep. They experience racing thoughts. They're more talkative than usual, and they tend to engage in more activities involving drugs or alcohol or spending or sex.
Symptoms of depression include being sad for most of the day, every day, for more than 2 weeks. Feelings of hopelessness, helplessness, worthlessness, loss of concentration, anhedonia, which is the inability to take pleasure in things that you formerly took pleasure in.
The manic episodes did not happen very often. I was way more depressed. It was a feeling of hopelessness and dread and lethargy. And then I would have these little bleeps where I would be really productive and everything was perfect and I had tons of energy and I didn't sleep very well.
Bipolar disorder, like most mental health disorders, does have a genetic component, but there's also clearly people who develop bipolar disorder who don't have any genetic background, and so there seems to be some environmental or psychological predisposition to bipolar disorder. A lot of trauma, use of substances, these kinds of things are all considered, but the reality is we don't know.
To qualify for the diagnosis, you only need to have ever had one manic episode in your entire life. So it can be kind of confusing if you're meeting somebody that presents with only depression in front of you, but they actually may have a bipolar disorder because they experienced a manic episode 5, 10, or 15 years prior. Bipolar disorder is generally treated with mood stabilizers. These are medications that help work with both the highs and the lows of bipolar disorder so that the mood is more neutral and more stable.
So the other important factor in treating bipolar disorder is treating episodes. Hopefully the mood stabilizer keeps you from having episodes, but if you do break through and have one, then in addition to the mood stabilizer, you would be on a medication to treat that particular symptom. In addition, psychotherapy is often helpful for people with bipolar disorder. Bipolar disorder untreated is dangerous. It really can wreak havoc with your life. Marriages split up, jobs are lost. In major depression, there is a 15% mortality rate from suicide. There's also a high mortality rate from suicide in a mixed state and in a manic state. So this is a deadly illness if left untreated. This is an illness that must be treated.
If you're having thoughts of suicide, get support. Call the Suicide in Crisis Lifeline at 988.